Welcome to On Call Medical Radio, a production of the Healing Words Foundation. Here with today's guest is On Call Medical Editor, Dr. Rick Holm.
We're here talking with Dr. Henk Klopper, who is a neurosurgeon from Avera Medical Groups, neurosurgery in Sioux Falls. Thank you for joining us, Henk. Let's talk about head trauma. The major thing that happens as a result of head trauma would be subdural hematoma?
That's one of the possibilities. There's a whole range of possibilities, from concussion that you recover from in a matter of days or weeks to injury that results in death or permanent brain injury that you don't recover from.
Head trauma, a lot of causes for head trauma. What would they be?
The most common by far in the United States would be car accidents, and also violent crimes. Not as much of a problem in South Dakota, but still a problem at times.
Violent crimes?
Yeah, gunshot wounds and assaults and so forth.
So the best thing to do would be to prevent these.
Yeah, absolutely. The best treatment, I think, is to prevent the injury from happening in the first place. And I think that people can do that by doing things as simple as wearing the seatbelt, wearing a helmet when you're rollerblading or biking or skiing, making sure that the kids are, their car seat is appropriately installed, and also things that you wouldn't even think about, just like maintaining your car, making sure the tire pressure is okay, those types of things.
Oh, I hadn't thought about that. So a person with head trauma comes to you. You're a neurosurgeon. What's your workup?
The initial decision that you have to make is whether that person has a problem that requires surgery right away to prevent them from getting much worse or having a much worse problem. And that's come a long way with CAT scans where we can quickly get a picture of what's going on in the brain. And then a lot of what we do in treating head injuries is to try to prevent further injury to the brain from swelling or alterations in the blood flow to the brain that can come on after trauma. And sometimes we do that by putting fiber optic monitors in the brain to measure the pressure to tell us what's going on in the brain. And sometimes it goes as far as taking off a piece of the skull surgically to allow for room for the brain to swell.
Room for swelling. Yeah. We'll be back in just a minute.
Watch On Call. Physicians from around the state using science-based, reliable medical information to answer your questions live. Thursday nights at 7 Central, 6 Mountain on South Dakota Public Broadcasting.
We're back talking with Dr. Henk Klopper, who is a neurosurgeon from Sioux Falls. Final words, Henk.
I think I can't say enough about the importance of preventing these types of injuries, because they have profound impacts on people's lives and also on their close family members and those around them that care for them.
Wow. Thank you so much for joining us.
Thank you very much.
And thank you for listening. And until next time, stay healthy out there, people.
You've been listening to On Call Medical Radio. On Call is produced by the Healing Words Foundation and made possible in part by the South Dakota Foundation for Medical Care. The foundation strongly urges all of us to remember immunizations this season. Pneumonia and flu shots save lives.